I would really like to introduce to you now one of my colleagues, Indra Joshi, Dr. Indra Joshi, who has been Director of AI at NHSX for a little while now, previous to her role at NHS England. And Indra's going to give us a bit of insight into some of her work. And also Maxine Mackintosh, my co-founder from One Health Tech, is also going to just kind of ask Indra a few questions. These guys go back a while, so it'll be a nice, interesting debate. So I'm going to hand over to you guys now. Thank you.
Brilliant. Thanks, Lou. Can everybody, I'm just going to assume everybody can hear me. Everybody can see me.
We can see you. We can hear you. Your hair looks amazing, by the way, mate.
Oh, thank
you.
you.
You hear me? See me?
We can hear you. We can't see you. Ah, there we go. So, hi everyone, welcome. And in true One Health Tech style, Maxine and I have coordinated our haircuts. I've gone curly, she's gone straight, but we made sure that we were matching in some way or form. So welcome and thanks for joining us. Maxine.
Yeah, thanks. Let's go ahead. So yeah, as Indra said, we've got kind of a history of actually coordinating haircuts. So we got a fringe roughly at the same time, and now we've got our bobs at the same time. So I'm sorry about that. So by way of background, we had a little bit of a chat, kind of planning about what we wanted to talk about today. And as both people who are quite significant data nerds, we thought rather than necessarily do a deep dive into solely some of the specific work that especially Indra is working on in the diversity space, we wanted to talk about a little bit where data intersects with diversity. We wanted to have a little bit of a conversation around privilege, and also a little bit of a conversation around how grassroots networks interact with top-down initiatives, which is quite a lot to cram in what is basically sort of just over 10 minutes. So maybe you want to grab your coffees now, and because this will hopefully be quite an informal chat, so that you have a slightly longer coffee break whilst Indra and I have a bit of a natter. So my day job is I'm a research fellow at the Alan Turing Institute, which is the UK's Institute for AI and Data Science. And obviously Indra, through her role as the AI lead, we're both kind of quite AI in the way that we go about our daily activities and lots of our work. And one of the conversations we had yesterday when we were thinking about what we want to talk about was, what does diversity mean when it comes to collecting data? What does ethnicity data really mean? So just to have a bit of a conversation around that. So Indra, just to kind of kick us off, why do we have a kind of problem with the collection of ethnicity data, and where are the big gaps at the moment, and why does collecting ethnicity data kind of really matter?
So, I mean, you know, the last few months has really shown us that collecting a proportionate data set is really, really important, especially as we do not want to increase the widening health inequalities divide. And one of the things we saw quite early on, and it became a bit of an interesting question, was the way we collect diversity data. So it's very difficult to to do this over a camera, but normally, you know, you kind of ask the audience, and this would be a great interactive session to kind of say, you know, when you look at those boxes that you have to tick, quite often they're not really representative of your particular background or where you're coming from. And so when you're actually trying to look at the inequalities that data might show up, it's actually quite hard to code those effectively. And that's something that we're thinking of, well, how do we actually make sure that we collect data sets from different cohorts of patients, but make sure that we represent them properly? So it's not a kind of, and it's a personal bugbear of mine, would tick the box that says Asian. I mean, yes, I'm Asian, but Asia is a huge continent and actually has quite a lot of diversity within that tick box. And so I think really narrowing that down and kind of being a bit more open about this dialogue to say, yes, we don't do it correctly, we don't do it in a way that's really representative, but, you know, how do we improve that and how do we move forward? So this has been something that we're quite interested in pursuing. And I've seen mostly, I don't know about other colleagues on the phone, but I quite often do what I call my CPD, continuing professional development, on Twitter. And there's been some quite recent interesting articles that have been floating around the Twitter sphere over the last few days on how we are building algorithms. I mean, it's not new, but how it's been really noticed how some of the data sets that we're building algorithms on really do exclude certain communities. And we know that's been a case across multiple different industries. So we're not talking about health specific here, but travel or otherwise. But we're now seeing in publication data that there is a gap here. And this is something that we in the AI lab feel quite passionate about and are working with colleagues to try and say, well, how can we address this particular issue?
Yeah, and that's really useful background. So this is a conversation that we've had a lot at the Alan Turing Institute, which is how do you incorporate ethnicity data in models? Because if ethnicity is a really important factor in determining certain types of outcomes, say in COVID response, you should really include it. But at the same time, you're not really, ethnicity is not a risk factor. It's a latent structure for lots of other things happening on top of it. And as I suspect the self-organizing, self-selecting group of people who are attending this will agree that race is a social construct. And so, what are we really trying to pick up when we're trying to incorporate ethnicity into these models? And what's the kind of journey we have to go on? Do you think we have to just get better at coding in the first place to build awareness, and then try to think more nuanced about what ethnicity really means in these models? Like, what's that journey we have to go on in order to use ethnicity data in the most appropriate way in some of these models?
I think it goes back to the point of, well, what's the problem we're trying to solve? So quite often when you're building something, so if you're looking at a progression rate of a condition, for example, and you're building a model on that, talking about ethnicity, but it could be a wider range of inequalities, including, if you're, say, physically impaired in a certain area, like capture that so that it's representative when you're coding, but also when you're building your model. So you understand, okay, there's a skew here. So what does that really mean? And I think we need to raise a lot more awareness. We raise awareness of this as an issue, but actually we raise awareness of it as a broad issue versus actually go down to the detail, go down to what it is, raise awareness at the point of, don't just tick a box here, but think about what does that box, once you've ticked it, mean for that person in front of you for the rest of their kind of care journey. So I think there's two aspects that I mean, it'd be interesting to hear, Maxine, what your views are on this as well.
Yeah, ultimately, what we're really kind of, well, I was working on this project as part of Delve, which is a Royal Society initiative, and we were specifically working on a report inputting into Sage on why there's a variation in outcomes amongst specifically looking at the Black population, and kind of disentangling morbidity versus mortality, and as many people will know, it boils down to disproportionately socioeconomic status. So when you look at how outcomes of COVID vary across different ethnicities in Scotland, it is the most deprived white men who have the worst outcomes. So that's one thing. But the second thing is that ethnicity most of the time is really about cultural heritage, and that's a really difficult thing to capture in a data set. I remember when Facebook tried to broaden their individual gender identities, they had 42 in the drop-down menu, and I would completely agree with you that the current list is inefficient and insufficient, but is a drop-down list of potentially thousands of different types of ethnicities realistic? And so I want to kind of bring in a question from Shilpi Sinha here, which is about what, and this is something that you and I have talked about, which is really about what initiatives are currently taking place to look at the standards by which we should be thinking much more scalably about how we incorporate ethnicity and code ethnicity and collect ethnicity. So can you give us a bit of a sneak preview about some of the initiatives that are happening in the centre?
Yeah, I mean, I don't think it's a sneak preview. I think we've always been quite open about how we need to improve data capture and data quality standards, and we've got a new director who's come in, Irina, who's been working on this across the spectrum. But from an AI perspective, specifically when we're looking at building models and ensuring that, we're looking at partnering with a number of think tanks to say, well, how do we help researchers start thinking about this in a way that makes it much more embedded into practice? So, for example, a few years ago, I mean, it's slightly unrelated, but related, we weren't looking at the reporting standards for clinical trials in AI clinical trials. And so there was a large group of academics across the spectrum, and they'd done some brilliant work with the consort on the Spirit guidance that's just come out recently. And along those lines, like, is this something that we really need to bring an international community together to start thinking about this? Because this isn't a UK problem, this isn't an England problem, this isn't an international problem. And we all need to come together to really think about that from an academic perspective, but also then from a policy perspective to say, how do we then embed that into our guidance and our standards? So we're looking at pushing some of this forward through the lab. So watch this space as we embed this more into a proper programme, is what I'd say. Sneak preview.
Inverted commas, yeah. And sorry, there's a bunch of lorries that are in and out of the road in front of me, but my window unfortunately is wedged, so sorry if you get some loud beeping. So going now to a bit more kind of personal, we were reflecting yesterday about the potential kind of experiences and discrimination that you and I have ever received. And I'm a woman, you're an Asian minority woman, and you and I met through One Health Tech, which is this intersectional community that looks to support diversity in health tech. And we were reflecting that whilst we think we've experienced, effectively microaggressions, the little kind of, I had that, I felt that, we by and large feel that we haven't actually had a really tough time. And in my case, I'm a tertiary educated white woman, and Indra, you're not too bad yourself in terms of where you are in the world. And so we were reflecting about actually whether the kind of intersectional perspective about this, and the fact that actually we should be thinking a little bit more specifically about what it is about being certain types of minority groups really puts you at disadvantage. So I don't know, Indra, if you wanted to kind of talk a little bit about your experience and your take on when you feel that people are disadvantaged based on certain types of characteristics, how we can maybe be a bit more nuanced in our take on it.
Yeah, I mean, I know Sonia talked about this earlier, but there's a real drive to try and make sure that you're much more inclusive. But I think one of the things I've noticed a lot, and this is from a personal perspective more than anything, is quite often when you join big organisations, and the NHS is a classic big organisation, even having worked in a trust on the front line, it's a huge central London trust, you're already quite lost as a junior doctor, moving into the national organisation again, which is a massive place. Having those networks and having people that you can reach out to on an informal basis is something that really helps. And I think for me, more than being I'll be honest, being a brown woman in a society, being a woman in tech has actually been a lot more of a bias more than anything. And so what I would say is, reach out, reverse mentor. There's no harm in it, and also go out and talk to the we were talking about this last night, but go out and talk to the younger generation as well. I think their vision of what the world will be and what it is currently is far different to ours. And I think putting yourself in that mindset, quite often we can put ourselves in a mindset as like, this is being done to me, or I'm powerless to do this. But actually slightly changing your mindset, reaching out to other people, and really ensuring the use the power of networks, I think is really good. I mean, those are personal reflections, but Maxine, I know you've got some too.
Yeah, no, I think that's really well put. One thing that we started to become very cognizant of at One Health Tech was that events just like this one, or events that happen in the evening, you have to have a certain amount of privilege in order to even engage in a network and engage in a community. You have to have the privilege of time, even if you can't have the privilege of access because you live in a different city, for example. And so one thing we did was we set up this accessibility fund where people can apply for any amount of money up to £100 in order just to come to a meetup. So that could be spent on live captioning. It could be spent on offsetting loss of earnings because someone's got, a Thursday evening job. It could be, often childcare. It could be transport because someone lives in the arse end of nowhere and it would take them 5 buses and a train. And it was just fascinating by saying, OK, we're just going to give you money. Because actually for us, it was way cheaper because it didn't mean that we had to organise creches, live captioning, everything at every single one of events. And we just kind of put the onus on the people to spend the money in the way they wanted to. But for us, it was a real learning experience to work out the barriers that people experienced in interacting with networks. Because I agree, once you've got your foot in the door and you're in communities, like fantastic communities like Shuri, OHT, the HSN network, these are all fantastic networks. But we also need to realise the privilege in access of a network. So I think that's kind of an interesting point. I'm cognizant that because we ran over a wee bit before, and it is very important not to get in the way of all of your coffee breaks. So I hope that you've all already put the kettle on in preparation to have a quick 5 minutes of a drink. I don't want to kind of keep you for too long, but Indra and I are obviously reachable in other formats if you want to kind of continue this conversation. I feel like we've only just skimmed the surface and whet the appetite of data nerdery and privilege and networks, but I hope it's been a kind of interesting 15-minute rambling for you all.
It has. Thank you so much, Maxine and Indra. And could I just ask you before you go, I mean, I know we are supposed to be on coffee break, but I'm sure nobody will mind. But, for a final word from both of you, about, whether it's your experiences, about, about what we're talking about diversity and inclusion in digital health, what's kind of the one takeaway or the one thing that you'd just like to share with this group while you're on?
So I think it's understanding the purpose of your diversity. I think Indra used the word proportional opposed to diverse when she was talking about data. And I think that for me really hits the nail on the head, like thinking more about representativeness, for example, in algorithms, understanding exactly what it is you're trying to achieve by being more diverse. I think sometimes we think, oh, if you've got a woman, a gay person and a black person on a panel, you smashed it. And so I just think really understanding why you're trying to get more voices in the table, I think is important. And that's something I sometimes struggle to justify also why, but I often don't understand why people are getting certain voices around the table.
Thank you. Indra?
I mean, from a practical perspective, look at, if you're building a product, look at what that product is really doing. So people talk about, is it working for everybody? But if it's so for example, if it's a product designed for a child, it shouldn't really be working for adults. So really think about, when you're talking about both data and product, who is that for? And then think about the unknown things. So people often forget about accessibility. I saw in the chat there were people talking about, some really simple buttons, but I mean, these are really small things, but people quite often forget about it when they're building digital products or data-driven products, to forget about the simple things that from an end user perspective, whoever that end user might be, really think about what is it that's going to make their life easier, and make sure that you've included them in the conversation of the design. Don't just kind of stick them on. And I say this as a clinician, because clinicians always get stuck on at the end of a design process. Oh, but check with them. And quite often embedding them up front is always quite helpful.
Great. Okay, I think that's a good point to leave on. Yeah, let the clinicians tell us what they want, so we can really help the patients. Yeah, ultimately that's what we're all about, isn't it? Okay, ladies, thank you so much. It's great to see you both, especially with such amazing hair.